Good morning, everyone. We've recorded 12 new cases overnight. 11 of these are linked to existing cases and existing exposure sites, so that is good news. The final case is undergoing interview at this moment. We had 6,804 tests in the last 24 hours, so still a very high level of testing. Thank you to everyone in the community for coming forward. I'm advised this morning that waiting times are lower across our testing sites than has been the case previously. So if there are people who've been waiting for the lines to reduce and waiting times to be shorter to come forward for testing, today is a good day for that, but please continue to monitor the social media updates on waiting times across our testing centres. I can advise that both the Gold Creek and Erindale testing centres are now open to the general public. We have 20,372 people in quarantine at the moment. ACT Policing and Access Canberra are reporting incredibly high levels of compliance, and that is really pleasing to hear. ACT Policing undertook more than 150 hotel and home compliance tests and checks in the last 24 hours, 85 business checks. They conducted 760 traffic stops with only 12 turnarounds, and 12 cautions were issued, and the Chief Police Officer advises they were mostly for people not wearing masks. Now, on vaccines, yesterday people will most likely have heard that the Commonwealth announced that eligibility for Pfizer vaccines would be expanded to 16 to 39-year-olds from next month. This was announced with no advance notice given to states and territories or any information on the vaccine supply that would be necessary for this to happen. So at this point, we are still awaiting further information from the Commonwealth. I have National Cabinet immediately after this press conference, and so I hope to have some further information provided at that meeting. We will update the community as soon as we have information from the Commonwealth on how and when the vaccines will get to the ACT. Of course, we have already started vaccinating 30 to 39-year-olds with Pfizer, and 31.3% of Canberrans in that age cohort have now received their first dose of Pfizer. In terms of 20 to 29-year-olds, 25.5% have received their first dose, and amongst 16 to 19-year-olds, 10.3% have received their first dose. These people will have been in the earlier vaccine priority categories. Work is continuing to stand up the AIS Arena as the next mass vaccination hub for the ACT. This expanded capacity will allow us to open registrations for a very large cohort, the single largest cohort of our population, 16 to 29-year-olds, to access Pfizer at an ACT government clinic once the vaccine makes it to the ACT, and that's the crucial bit of information that we are waiting on. We hope to have more details for the community next week. The biggest issue that we are facing, and we know there's huge demand to get vaccinated, is available Pfizer supply. AstraZeneca is available, and GPs and pharmacists have been ordering more. And one of the things we have been seeing is young people getting vaccinated with an available vaccine. And with the appropriate conversation with a trusted health professional, that is the right thing to do. In terms of ACT government mass clinics, our bookings are right up until mid-October. So we know Canberrans want to get vaccinated. We are doing all we can to support you to get vaccinated. The thing that's holding us back is available vaccine supply. But as more supply arrives, we'll be able to open up more bookings and more opportunities for younger Canberrans to get vaccinated, either through an ACT government clinic, through a GP or a pharmacist. National Cabinet meets in a little over an hour. I'll take the opportunity to raise a series of concerns at that meeting. most particularly about our nation's plans to protect and vaccinate children and young people from the virus. National Cabinet needs to consider the rollout of a safe and effective vaccine program for Australians aged under 16. There are a range of very significant issues that need to be considered here. There won't be outcomes on this from today's meeting, but it is a very important issue that I know are on the minds of so many Canberrans and Australians. I will also be seeking assurances in relation to what is meant by the 70% and 80% vaccine targets that have been talked about so much, drawn from the Doherty Institute modelling. We know, and every Chief Health Officer around the nation has been saying this repeatedly, but maybe not enough politicians have been saying this, that the vaccine is not immediately effective once it's jabbed into your arm. It takes several weeks for it to reach effectiveness. And that applies to both the first and the second dose. So when we talk about 70 or 80%, we must talk about when the vaccines become effective, not just the moment the jab goes in your arm. Targets are not reached on the day of vaccination. It takes time. In relation to business support, yesterday I provided the Commonwealth Treasurer with a proposal for several jointly funded programs with the ACT Government. I outlined the details of those programs yesterday. I want to thank the Treasurer and his office for working very closely with us, and we look forward to finalising those arrangements and being able to make an announcement in the coming days. In terms of community support, access to the Commonwealth's COVID-19 disaster payment is now available through Services Australia. I know thousands of people have already registered and are in the process of accessing that payment. There is information on eligibility on the Services Australia website. Please go and have a look. If you're in any doubt, please contact Services Australia to ascertain your eligibility. Today, the ACT Government has announced additional support for Canberrans in need. This includes funding to volunteering ACT for emergency food relief, funding to community sector partners for mental health support, and funding for a range of further crisis and emergency supports to be delivered in partnership with the community sector right across Canberra. All of the issues and challenges that we are experiencing at the moment are difficult. It is a tough time for our community. I know that we are all feeling it, but we are working with all of our partners, other governments, the community sector, businesses, doing all that we can to support the most vulnerable and those who are doing it tough at the moment. I encourage you to reach out to the wide variety of services that are available at this time. They're there to support you and your family, and it is really, really important that people feel they can reach out for that support. It will be there for you. So in summary, we've recorded 12 new cases. It's gone from 1 to nearly 100 inside of a week. It demonstrates how quickly this virus can spread, but absolutely reinforces why the lockdown was necessary, and it's important that we stay the course. We have two choices. We see this through, we see the numbers continue to reduce, or there's the alternate path, and people have seen how that plays out elsewhere in Australia. The best news today is that already 11 of the 12 new cases can be linked, and that speaks volumes of the great work of our contact tracers. So thank you to everyone across the community, and particularly within ACT Health and our private partners who are delivering an amazing array of services for our community. I'll now invite Dr. Coleman to provide a further update on the epidemiology and a range of other issues that she needs to update the community on. Thank you.
Good morning, everyone, and thank you, Chief. As many of you know, my name's Dr. Kerryn Coleman and I'm the ACT Chief Health Officer. And as already announced this morning, since our update yesterday, we have recorded 12 new COVID-19 cases, which brings the total active cases in the ACT associated with this outbreak to 94. Noting we reported a total of 83 cases yesterday, many of you will be calculating that in your heads and thinking that we're out by one. This is because we identified a duplicate in our system yesterday and so have removed that from the numbers. This is just a normal part of our ongoing quality assurance of our data collection. So of our new cases today, I can confirm that of the 12, there are 11 linked to known cases according to our preliminary information, with case investigations for this 12th case being conducted this morning as a priority. Out of the 94 total cases, 6 are under investigation, and this includes the source infection for this outbreak. Today we also have 1 patient in hospital who was confirmed as a positive case at 1 a.m. this morning. At this time they are stable, not requiring ventilation or any intensive level of support. We are currently working closely with the hospital on identifying any contacts, and we will be directly contacting those people. Since our last update, we have over 18,200 close contacts who have self-identified through their forms, plus over 5,000 casual contacts. So thank you everyone for continuing to let us know when you are a contact. We also have over 260 exposure locations listed. As you know now, our list of exposure locations are being updated on the ACT COVID-19 website every day, twice a day, and it's important that you check the website and stay up to date as new venues are added. Can I also note that we are continuing to receive a high volume of calls. So can I please ask again that if you can find the information elsewhere and it's not critical at the moment, please give the website a go and come back and call if you still need to a little bit later. We are also receiving a high number of exemption applications. Our exemption teams are now working around the clock to try and process them, and we've added additional staff every day to help us process these applications. Some applications are taking us a little longer to work through due to the high levels of demand, but also the complexity. As you can imagine, the risk has escalated in our surrounding regions, and it can be quite a complex task to understand the risk being posed and balancing that off against the reason for coming into the ACT. But I do want to assure you that we are prioritising these requests and prioritising those ones that are coming in for essential reasons. But every request will receive a response. It just might take us a little bit of time to get there. Today, you will see the addition of some public transport routes to our exposure locations, and also those that are currently on the list of exposure sites will be reclassified to a casual contact site, which is good news. But being a casual contact, the reminder is you still need to fill out the ACT contact declaration form, immediately quarantine, and follow that advice on the website. So just to provide a bit of an update on the broader outbreak itself, 94 cases in the outbreak that live in the ACT, and we understand that 87 of these have confirmed linkages. This is amazing work, as the Chief has spoken to. That leaves us with 7 under investigation, with one of those being the new one overnight that we are prioritising for work this morning. We also have 3 cases in our surrounding New South Wales region, which are part of the ACT outbreak. So at this time, 43% of people in this outbreak are aged 0 to 17 years, and that is associated or reflects the focus in the school clusters that we are having at the moment. More broadly, 46% are aged 18 to 44, and 11% are aged over 45. Our public sites of transmission remain at 7, When I talk to the number of cases associated with each of these exposure site clusters, just take these with caution. Sometimes a person is associated with multiple exposure sites, so therefore they will not necessarily all sum together, and they will often change as new information comes. But we use these for operational purposes to help us understand where the greatest risks are and assess how confident we are in getting on top of each of the areas. So Lyneham High School now has 25 cases associated. Fiction Nightclub, 13. The Lennox Jaguar Land Rover dealership, 8. Gold Creek School has 5. Belconnen Basketball Stadium, 3. Downer Community Centre has 3, but many close contacts and secondary contacts. And the Assembly Bar has 3. I'm also pleased to say that at this time there have been no further cases that have been identified at Greenway Views Village, but our work continues out there. So before I finish, I just wanted to take the time to remind everyone that when you are heading out for your hour of exercise, it is important that you are staying in your local region and that you don't travel to other parts of Canberra. Just a reminder that this is about reducing your mixing. We are working very hard to get this under control, and we need your help with that. I think that's all for now. Thank you, and the Chief's available for questions.
Thank you very much, Dr. Coleman. Now, obviously, for those watching at home, I will be here for about half an hour of questions, and then I need to go, and so others will take questions. So all the questions will start coming to me, I understand, in the beginning. So first up.
So there were reports in The Australian today that once 70% of New South Wales is fully vaccinated, those people would have freedoms to go to gyms, bars, etc. What do you make of that? Is ACT likely to do something similar?
Well, obviously I refer to my remarks in the opening comments about we need greater clarity on what we mean and what politicians mean when they say 70%, and that there would be a lag between when the jab in the arm of the person that represents 70% of New South Wales goes in, as opposed to when that vaccine would be effective across that 70% of people. So I think we need to look a few weeks beyond the 70% jab time to get 70% effective vaccination. So that's the first point. On the other observations, well, that would still leave in New South Wales, probably several million people unvaccinated and at risk from those 70% vaccinated unknowingly transmitting the vaccine. So there are considerable risks associated with that. Now, look, unattributed comments to the Australian newspaper are not necessarily to be taken as official New South Wales government policy. So I would reserve my judgment on that as a piece of public policy until New South Wales formally confirmed it. Clearly, what they do and the settings they put in place between now and the end of this year have significant implications for the ACT, but also for other states and territories. So that, I guess, is the answer to most of these speculative questions about what New South Wales may or may not do. We will seek further clarity from them because undoubtedly, as I have been saying for some time now, what they do has implications for everyone else.
The ACT had lots of relative freedoms before we were locked down last week. Do you have a number in mind as to when we could get those numbers back in terms of number of people vaccinated or percentage of population vaccinated?
Well, look, we're striving for more than 70 or 80%. And I think the evidence in terms of the cohorts of Canberrans who've had access to vaccination demonstrates that we'll shoot well above 80% here, that over 70s are in the mid-90%. So I think it's reasonable to want to get to that level of vaccination across our entire community. Again, I'm worried about under 16s. I'm worried about what we're seeing at the moment. But of course, I recognise that we do not yet have an approved vaccine for children under 12. The other factor in my thinking, and I know in the thinking of many people, is not just the protection against the virus becoming the disease, but also what is happening in parallel in terms of improved treatment for people who do contract the disease. And so that's another factor we need to consider. If we can treat people and avoid severe illness, combined with protecting them from getting the disease in the first place, that combination of factors can make a big difference to the public health settings that you have in place. But people do need to understand what the Doherty report says. And it doesn't say that Freedom Day and no public health restrictions come into place at 70 or 80%. Just talks about not always having to have lockdown as the answer at 70 or 80%. But there will still need to be a range of public health measures in place, absolutely very strict at 70%. And at the moment, we're sitting at about nearly 35% fully vaccinated, noting that it'll then take another 3 weeks for the last few percent who've been vaccinated in the last week or so before they've got effective protection. So I think one of the challenges that everyone is balancing at the moment is wanting to give hope about the future, and I understand that, and it's important, and that the community knows that we're working towards something that will make a difference in everyone's day-to-day lives, but not offering up false hope about what the future will look like. It's still a tough road ahead of us.
Minister, in terms of business support, we've heard from sole traders who earn less than $75,000 that they feel as though they've been cut off and they can't access anything. Are there plans to support these people?
So there is eligibility for people in those circumstances through the COVID disaster payment, Services Australia payment, if you've lost income in that context. And so that, I think, support is about $750 a week. We have some programs that target businesses with turnover between $30,000 and $75,000. I've raised this issue with the Commonwealth Treasurer. We're certainly looking at it, but there is at least always a safety net, and that is the COVID disaster payments. And that is appropriate in the context of a sole trader that don't have any other staff, it's just them. They are able to access some support payments.
Were you frustrated yesterday when the Prime Minister came out and made the announcement without, consulting you or your fellow state and territory leaders? And will you be expressing that frustration today at National Cabinet?
Well, look, the Prime Minister is, of course, able to make whatever announcement he determines. But it's clear from the feedback across the Federation that this one was a bit of a captain's call. Now, the Prime Ministers and First Ministers will do a range of things at times. The Prime Minister has generally been very good at providing a heads up. Sometimes we only get a few minutes, but at least he tells us. This one came completely out of the blue. Now, I'm not opposed to what he's announced. I just need to understand how we're going to do it, and we don't have any information about that. So immediately our phone started ringing, you all started asking questions, and we didn't know anything about it. We'll hope to get more information and be able to answer all of the questions the community has. And so when the Prime Minister speaks, people do listen, and it does have implications. And so it's helpful, I guess, if we know.
The NT government recently identified the Canberra airport as a COVID hotspot, which is apparently causing some issues for people undergoing hotel quarantine in Canberra before wanting to return to the NT. Will you consider asking Michael Gunner to relax those restrictions?
Well, look, we'll have some conversations with the NT to see if we can provide them with some assurance in relation to the airport. I mean, clearly there was a case that transited through the airport. But there are some very strict protocols in relation to airport transit. But they are places, maybe not so much at the moment, given there's almost no one travelling, but they are generally places where a lot of different people from a lot of different parts of Australia mingle. That's why there have been the extra protections. I mean, mask wearing had been required at airports throughout.
Chief Minister, you've shared your views very openly about the handling of the COVID-19 situation in New South Wales. Premier Gladys Berejiklian has just announced a raft of new measures. How satisfied are you with those?
Well, look, I've heard sort of the headlines on what they are. I haven't had the opportunity yet to look at the detail, as when she announced them I was in a Treasurer's meeting, and I've just heard a little bit on the car radio as I was coming into this press conference, but I understand that they are a range of further measures that were requested given the situation in Sydney. I guess in all of these circumstances, we will be supportive of whatever New South Wales can do to get their case numbers down, because that has an impact on us particularly, but also on the rest of the country. And I've said more than once that the best time to have done some of this was many weeks ago, but I guess the next best time is now. So if it does help, and I hope it does, because the pathway for us and what the rest of this year looks like for the ACT and for other jurisdictions depends a lot on New South Wales being successful, and I hope they are.
There's still a sentiment of frustration among business owners about not being able to access their businesses in order to fulfil online orders. Will you relax the rules or provide further clarification to allow them to do that?
Yes, we are actively looking at that. We've heard those requests. We're looking at how we can manage that in a COVID-safe way. I believe there is a way forward on that, and we look forward to being able to work through the detail. We've been working with a range of industry associations, and we've got a number of individual case studies, but we need to take a little bit of time just to work through that. So I'm not announcing anything today, but I do understand the issue, and we are looking at finding a safe way forward. Right now, though, and I think people would understand this, we're not in a mood to make too many risky calls at the moment. This entire community has put in an extraordinary effort. But we're still having new cases every day, and we are not far enough into our lockdown yet to be able to say that the new cases have been in isolation during their infectious period. So we need to let the lockdown work. I appreciate the frustration. We are looking at it, and I will have something more to say on it in the coming days.
So in the coming days, people can expect a formal update, I guess?
Yes.
But perhaps not tomorrow?
Look, you will be aware, I've just canvassed a dozen critical issues for the Territory. There's a range of very significant local and national policy issues. This is amongst them. We're working on it. I'll make an announcement as soon as I can.
Do you have a sense of the figures as far as expressions of interest from ACT businesses for the two categories of COVID-19 business support grants being funded by both the ACT government and the Commonwealth?
Yes. So in some categories it's in the hundreds. In one category it's in the low thousands. When you add all of the requests, and some businesses are eligible in multiple categories, it's around 5,500.
And what about the number of employees you expect will put their hands up for the COVID-19 disaster payments?
I'll need to get information from Services Australia on that. That's obviously a Commonwealth program, and they have the direct data point, but they do provide information for other jurisdictions, so I'm sure they will for the ACT as well. Once that information is available, either you or I will track it down pretty soon, I'm sure.
We're yet to see a real rapid escalation in COVID-19 cases in the ACT. How confident are you that this lockdown is working and we really are on the front foot as far as containing this spread goes?
I think the Chief Health Officer has been very clear in her daily updates of the fantastic work that the contact tracers are doing. I observe we've gone from one case to nearly 100 in a week. If there was no lockdown and we just let it rip, it wouldn't be 100 cases, it would be possibly in the low thousands, and we would have a serious problem, a Sydney scale problem. So I think I can say with a degree of confidence that the lockdown is having its desired effect, but the incubation period for this virus is more than 1 week. And so that's why we've got to stay the course here. So I don't want to waste the first week and the effort of everyone by taking too many risks over the next 7 days. But once we are through the first 2 weeks, we'll be in a much better position to know exactly where the virus remains in our community, and by this time next week, you would hope that there aren't many, and hopefully none, new cases that have been infectious in the community. That's what we'd hope to get towards, as I've been saying every day.
Looking forward to the school holidays. So assuming regional New South Wales and the ACT are out of lockdown, we know Sydney will still be in lockdown as confirmation from the New South Wales Premier today. Do you think there'll be any travel? And if so, will you have to kind of ramp up border controls as you did during the Northern Beaches outbreak? Would you consider bringing ADF personnel in, for example, or anything like that?
Too early to speculate on that. What's that, about 6 weeks away? I'll take that question on notice. We obviously will be thinking about what happens towards the end of September, but it's just too difficult at this point to be making any definitive statements about what the end of September is going to look like.
And at National Cabinet today, you said you would be pushing the need for getting vaccinations for children. What do you make about the idea of giving priority vaccines to people in Year 11 and 12?
Well, look, we are looking at all of our vaccine programs, and it all comes down to availability. So once we get confirmation of supply, clearly Year 11 and 12 would predominantly be 16 and over. Might be a few 15-year-old Year 11s, but certainly Year 12. By the time you're in Year 12, you would be over 16, so you would become eligible in that context. But at the moment, we don't have any Pfizer available until the middle of October. So unless that changes, that's the time frame that we're talking about.
You've consistently said how the ACT's situation is related to New South Wales, and that's concerning, but also, we're kind of doing our own thing as well. In terms of the New South Wales Premier saying the evidence for curfews is mixed, but she's bringing one in anyway, does miscommunication, in a sense, have an impact there, in the sense that your government's communication has led to or has helped with our success so far in this lockdown?
Well, look, I certainly appreciate the feedback that we have been receiving, in terms of these press conferences, through the media, through direct communication with our officers, our political officers, through emails and phone calls and all the rest. Now, we do our very best to be clear and concise in the information that we provide, and that where there is a situation where people are unsure or uncertain, that we clarify as soon as we can, and to use the multiple communication channels that we have available to us. This 45-minute, hour-long press conference is amongst the most watched things in the city at the moment. I'm aware of that, and that's why we put so much effort into clear communication through this forum. But it's not the only channel in which we can communicate to Canberrans. And certainly I want to take the opportunity to thank the media across the ACT in all of its various forms, traditional and new, for assisting in the communication task. And then obviously we have a range of direct channels where we can pretty easily reach several 100,000 Canberrans through our communication. So a small jurisdiction is perhaps better placed to be able to communicate complex messages, and Canberrans are smart people. Statistically that is very clear, but they're also smart people who have common sense. And we're witnessing that. We're also very compassionate and community-minded people, and we're seeing that play out as well.
Chief Health Officer, if we can.
Okay, thank you very much, everyone.
So, over 25,000 casual and close contacts. How are we handling the contact tracing test load?
So that's a massive number for anyone, I think, and I'm sure that the community appreciates that. But we've been working on this for 12 to 18 months, and we have various aspects of new people and our surge capacity that we can pull in. We're actually having some other jurisdictions are giving us a hand. We've also some Commonwealth people are giving us a hand, also volunteers. So look, we'll continue to surge up as much as we need to, and our endeavours is to focus on those who are at the highest priority, at the highest risk, and work down. But you know what? We talk about this every day. There's heaps of information out there. Everyone knows that you've been to an exposure site location, what you need to do. So we just need people to do that. And on the back of that, our contact tracers are also doing what they need to do and getting in touch with you.
And you said we've got one case in hospital at the moment. Are you expecting, given, I guess, the high numbers of infections in younger people who we know tend to don't have such a terrible time with the disease, do you think we're going to see more hospitalisations or anything like that?
I think we need to expect, as our case numbers grow, that we will see people going into hospital, and then a certain percentage of those will need to probably have intensive care support. But once again, this is something that we've been working with the hospitals on. They have plans and they've had a timeline now to just re-energise those plans and get those things in place. So yes, I think in short, we need to expect that we will start seeing hospitalisations as we get more cases.
And we saw a few days ago there was a huge jump in the number of close contact sites, but that seems to have dwindled away in recent days. Are you expecting the number of new close contact exposure sites to go down, given that we've been in lockdown for a week? And is it likely to be more casual exposure locations from now on?
You're exactly right. That's exactly the purpose, or one of the purposes of putting in lockdown, is that once we identify cases that have been infectious since the lockdown time, the number of sites as well as the number of contacts should start to decrease, and we should start to be seeing that, if not now, very, very soon. We are looking at closely analysing that, and I will start to talk to that a little bit more as we discuss how our cluster or outbreak is expanding over the next couple of days.
And will the ACT start to provide updates on how many cases were infectious in the community versus isolated for their whole period?
So now that we're a week into our outbreak, that starts to become very important because people should be knowing when they're a close contact that they should be in quarantine, and therefore we become more and more likely that those people will only be infectious when in quarantine. So the team's been working through that important piece of information for the last 24 hours, and that's one of the things over the next couple of days we will start to be reporting on in this discussion around the epidemiological outbreak progression as we go.
Dr. Coleman, I think there's certainly a sense among Canberrans that we're on the right track. We're not seeing that those case numbers go up and up, higher and higher. You're the expert, though. How confident are you feeling that we're on the front foot?
I'm cautiously confident. So definitely we are seeing these cases that we have been seeing are what we would be seeing if we had not locked down anyway. Now is the time at which we start seeing the impact of the lockdown, and what we don't want to see is that exponential rise in cases that we have seen in some countries overseas where they haven't put lockdown in place. But noting that sometimes COVID is tricky. This Delta variant is very tricky, and we know that it gets into some part of the community that we have trouble getting to it. And that we are working very hard on trying to make sure that the entire community comes along with us and we're all working together to be safe.
Do you have an estimate of exactly, or a ballpark of exactly how many people, or how many Canberrans are in quarantine, given we know there's about 20,000 close contacts, but then the number of casuals aren't disclosed or secondaries?
Now that becomes quite a tricky piece of pulling a lot of different pieces of information together. Let me see what I have. So I think we have over everyone in quarantine, regardless of the cause for that, it is over 20,000 people. The greatest majority of those are associated with being close contacts as part of our current ACT outbreak. It doesn't include casual contacts, as you have mentioned, so there would be an additional 5,000 on top of that. Noting, however, generally those casual contacts have different time periods depending on their testing and other advances. So I think what we just need to say is that there's lots of people who are in quarantine for various reasons at different exposure locations or from different exposures, and that individual people need to be aware of why they're in quarantine and what they need to be doing.
Health Minister?
Lovely, thank you.
Thank you.
Had to happen at some point.
So So it appears, just based on testing wait times, that that we're being able to handle the load a lot better. Is that a result of having more testing centres, or is that a result of fewer people needing to come forward for tests?
Well, it's both, but it is definitely a result of us being able to ramp up our testing. So in the last 24 hours, of course, we still had well over 6,000 tests conducted and more than almost 7,900 results returned. So just over a week ago, Wednesday last week, we were at around 1,200 across our ACT government sites. So we wouldn't have been able to manage that number that we had yesterday through the existing sites we had. So definitely the ramp up in sites and availability has been incredibly important and continues to be important. And again, I want to thank our partners at Capital Pathology for their work in this space as well. And we know that people are going to have to come back for a second and sometimes a third test as well. So those more than 18,000 people who are identified close contacts are all in quarantine. They're all going to have to come back for at least a second test sometime during that period. And anyone who tests positive will generate hopefully a much smaller number of close contacts, but those numbers will continue. What I would encourage people at the moment, and I know the Chief Minister gave a shout out as well for people to come forward to get tested if you've been waiting for those times to come down. Certainly anyone with symptoms, if you have symptoms but you think, oh, well, I haven't been at an exposure location, I've probably got a cold, now is the time you absolutely must come forward for testing if you've got symptoms.
And there's no priority testing today, is that right? Given, Erindale and Gold Creek are now open to the general public?
Yeah, so today Erindale and Gold Creek are open to the general public. We are also doing work to ensure that we can provide more accessible testing and more widespread accessible testing for people with disability and those with underlying health conditions who are not able to wait or for whom the normal environment of our mainstream testing sites might be difficult to manage. So we're working around doing that, particularly at Gold Creek and at Erindale. And even today, if people turn up and they need some additional support at Gold Creek or at Erindale, please talk to the security team there and they will be able to get people the support they need, get them in quickly and get them out quickly, for example, if they're not going to manage the sensory overload that might be associated with coming to get tested. So we're working very closely as well to expand our capacity to do in-reach testing. I want to give that message out to people with disability in the community. We have heard your frustration about that there have been challenges in getting everybody who needs that accessible testing to get that testing over the last week, but we're working really, really hard and we're very focused on making sure that we can expand that accessible testing and ensure that we're providing support to everyone in the way that they need it so that everybody can get tested safely and effectively for them.
In Victoria, for people with a disability, they do at-home tests. Is that the kind of thing you're talking about?
Yeah, so we also have in-reach teams that do at-home testing for people who need it. But of course, we've been very, very busy and you have to organise that through the phone line, which has also been busy. And so I know that's been a frustration for people. But I would now encourage people who do need that support, call the COVID helpline on 6207 7244 and speak to them about that. Or if you are a close contact and you've completed that declaration form, you will have been provided with a direct phone number for the contact tracing team. And you can call that contact tracing team at any time to get some additional support, whether that's support to maintain your quarantine or whether that is support to get tested. So please use that contact information, get directly in touch with the contact tracing team if you need additional support.
Had a few questions regarding clarity between cross-border tests. We saw a few days ago that a few ACT residents went over to Queanbeyan to get their tests. So will those, if any of those test positive, will they come up in the New South Wales numbers or the ACT numbers, and vice versa if any Queanbeyan residents get their tests over this side of the border?
So I might hand that over to Dr. Coleman to respond to.
Yes, so generally the notifications work one of both ways. They can either be residential address goes to that area's notification, but we will actually manage the process, because if there are exposure sites that are in the ACT, then we will manage that. But if they're in New South Wales, that local public health unit will manage that. So that's how come I've reported them as separate today. So we have the 94 relates to the ACT cases here, and then we know of the 3 that are linked but have residential addresses outside of the ACT.
A couple more for the Health Minister, if that's okay. Minister, Goulburn residents have been arriving at vaccination appointments to be turned away or refused exemptions to come to Canberra. Will the ACT government reconsider letting those residents in and just confirming that Goulburn and Crookwell residents cannot come in for a jab?
No, so if people can really ring ahead and make sure that they have an exemption to come into the ACT for their vaccination appointment. We are not supporting exemptions at this point in time for people in those regions where they can get their vaccination in their local health district. So Dr. Coleman might want to talk a bit more about that.
Just to let everyone know, and because we all want to support vaccinations wherever possible, but we are very carefully monitoring that risk over the border, we are closely working with the Southern Public Health Unit, which encompasses Goulburn, and our current plan is to actually support or transfer those appointments for Goulburn residents to the Goulburn area and support them to be able to stay in their local area and have the vaccination. We're just working through the mechanics of that. Okay, thanks.
That the Goulburn region has enough vaccines for those that were coming to Canberra, particularly for second doses?
So I think part of that is about whether we need to provide some of the vaccines that they were going to receive here to them to deliver there. So this is about a risk assessment process, and really it's about reducing people movement where possible. And if that means that we provide those vaccines to Goulburn to deliver on-site in Goulburn, I think that's a really good news story for everybody.
Just one more for the Health Minister. Sorry. This week there's been, I guess, a flyer distributed outside the Magistrates Court that seems to have some misinformation or some claims about the Biosecurity Act. 18 months into the pandemic, how concerned are you that this kind of information is still being distributed?
Look, I think we've seen periodically people distributing misinformation, and I think, as the Chief Minister said, Canberrans are pretty switched on to this stuff. Generally speaking, the wilder the conspiracy theory, actually, the less seriously people are going to take it, and some of these are pretty wild. I haven't seen that particular one, but certainly there's been some pretty wild conspiracy theories out there being distributed. I think Canberrans are not going to take that stuff seriously. Having said that, it's worrying if anybody believes that kind of misinformation. It is concerning whenever anybody distributes that information, because somebody might believe it and they may decide that either they're not going to take the COVID-19 outbreak seriously and they're not going to take Delta seriously, which we of course need everybody to do, or they're not going to get vaccinated, which of course we want everyone to do it, go ahead and do, to protect themselves, to protect their family and to protect the community. So obviously we don't, we're very concerned whenever we see misinformation being distributed, but also I think we have good faith in Canberrans that they understand where they can get factual information, and one of those places, of course, is the COVID-19 ACT government website, covid19.act.gov.au. Thank you.
Thank you.